Welcome to The Explainer. Today, we're jumping into a topic that puts you, as a pharmacist, right at the heart of family care: infant nutrition. You're on the front lines, helping people navigate one of the most important and, let's be honest, sometimes stressful parts of being a new parent. Okay, let's start with a look at the data, because this is pretty striking. In Canada, almost 91% of families start out breastfeeding. That's a huge number, right? But now, look at that second bar. By the time we get to the recommended 6-month mark for exclusive breastfeeding, that number plummets to just 38%. That's not just a statistic, it's a massive gap. And that gap, well, that's exactly where you come in. It represents so many families with questions, facing challenges, and feeling uncertain. This is where you have a real chance to step in with solid, evidence-based support and make a huge difference. So, to get you ready for those conversations, here's our game plan. We'll kick things off with why breastfeeding is the benchmark. Then, we'll get super practical and talk about the formula aisle, how to handle common feeding issues, your unique role with medications, and finally, what to do when it's time for solid foods. All right, first up, why breastfeeding matters. Let's just quickly lay the groundwork and make sure we're all on the same page about why it's considered the gold standard. So, what do we actually mean when we say exclusive breastfeeding? Well, according to the World Health Organization, it's pretty simple. Nothing but breast milk for the first 6 months of life. The only exceptions are for things like vitamin D drops or any necessary medicines. No water, no juice, just breast milk. And why is this the goal? Well, the benefits for the baby are just huge, and they're really well documented. We're talking about lowering the risk for a whole list of problems. Everything from common stuff like ear infections and tummy bugs to really serious conditions like diabetes, SIDS, and even some childhood cancers. These are really powerful points to share with parents. And, it's not just about the baby. There are some major benefits for the breastfeeding parent, too. We see a lower risk of postpartum depression, type 2 diabetes, and even breast and ovarian cancers down the line. It really is a win-win. Now, while breastfeeding is the goal, we all know that for many, many families, formula is a part of the picture. And that brings us to the formula aisle, which, let's face it, can be a really overwhelming place. This is where your guidance is absolutely priceless. So a parent walks in and sees dozens of different boxes. The good news is you can boil it all down to just 4 main categories: the standard cow's milk-based ones, soy-based, and then the 2 types of hydrolyzed formulas. The first 2 are the most common. Cow's milk-based formulas are the standard go-to, with whey and casein proteins. Then you've got soy-based formulas. They're lactose-free, so they are an option for babies with a rare condition called galactosemia, or for families who follow a vegetarian diet. But, and this is a really critical counseling point, soy is not the answer for an infant with a cow's milk protein allergy, because many of those babies will react to soy protein too. Okay, this next slide is one of the most important distinctions you can make for a parent. We have partially hydrolyzed formulas, where the proteins are just broken down a little. These are often marketed for general fussiness or gas, but they are absolutely not for a true cow's milk protein allergy. For that, you need to point them to an extensively hydrolyzed formula. That's where the proteins are broken way down into tiny pieces, making them hypoallergenic. All right, let's shift gears and talk about those common problems that will have a worried parent showing up at your pharmacy counter looking for help. I guarantee this is the #1 question you're going to hear. This fear of not having enough milk is so common, and honestly, it's a huge reason why families decide to supplement with formula or even stop breastfeeding altogether. Your job here is to be a voice of calm, fact-based reassurance. You can help them reality check by asking about the concrete signs. What's happening in the diaper? How many wet ones? What do the poops look like? It's also super helpful to tell them about growth spurts. Babies will feed like crazy around 3 weeks, 6 weeks, and 3 months to boost the milk supply, and it's so easy to mistake that for a supply problem. And the other major hurdle? Pain. Nipple pain and trauma from a poor latch is incredibly common. And it makes sense, right? It's a huge reason people stop breastfeeding early on. You can really empower a parent here just by walking them through a simple latch checklist. Ask them things like, is the baby's mouth open really wide, like a big yawn? Are their lips flipped out, not tucked in? Can you hear them swallowing? And the most important question of all, is it comfortable for you? Okay, now we're moving into an area that is 100% your domain, where your unique expertise is absolutely essential: medications and breastfeeding. So, picture this. A patient comes to your counter and asks this exact question. They've been on forums, they've talked to friends, and they've heard about using a medication off-label to boost their milk supply, a galactagogue. They're coming to you for a trusted answer. And this is where you can be a lifesaver. With domperidone, you absolutely have to stress the cardiac risk, that risk of ventricular arrhythmias, especially with doses over 30 milligrams a day or if they're taking other QTC prolonging drugs. And with metoclopramide, the big red flag is that it crosses the blood-brain barrier, which means a risk of CNS side effects and, although it's rare, irreversible tardive dyskinesia. This is crucial safety counseling. Of course, nobody can memorize every single drug interaction. So have your go-to resources ready. LactMed is a fantastic free database from the NIH. Bookmark it. Mother to Baby is another excellent one, and for your pharmacy's library, the classic textbooks from Briggs & Freeman or Hale & Rowe are absolutely indispensable. Okay, let's wrap up by quickly touching on that next big adventure. Introducing solid foods. Your role as a trusted advisor doesn't stop after the first 6 months. Here's a simple timeline you can share. It all starts around 6 months, but only when the baby is showing they're ready, like having good head control. You want to start with iron-rich foods first. From there, it's a gradual journey of textures, from smooth purees to lumpy and mashed, and finally to soft finger foods by their first birthday. Now, one of the areas where parents get the most conflicting advice is allergens. The current science is crystal clear. Do not wait to introduce things like peanut and egg. You want to start offering them around 6 months, one at a time. And once you know it's tolerated, the key is to keep offering it regularly. This is a complete 180 from the old advice, so it's a really important thing to clarify for people. So, we'll leave you with this to think about. How can you be more proactive? Instead of just waiting for the questions to come to you, think about how you can build these conversations into your everyday practice. Maybe it's when a new parent picks up a prescription, or even just when they're buying diapers. Opening that door can provide a lifeline of support right when a family needs it the most.